Welcome to 50 Cents of Advice, dropping dimes of wisdom, 1 50 cent at a time. If you're turning 65 in the next 12 months, or you recently turned 65, stop scrolling. This video could save you over $10,000 over the next decade by helping you avoid 5 Medicare enrollment mistakes that trigger permanent penalties and surprise costs. Medicare enrollment seems straightforward. Turn 65, sign up, you're done. But I've identified 5 landmines that consistently blindside people, and here's the kicker. Most of these mistakes can't be fixed once they're made. They're like that tattoo you got in '87, permanent and expensive. I'm Eli Pennywise, and I'm here to cut through the financial BS that nobody else wants to tell you, especially when it comes to the stuff that actually matters for folks like us. Today, we're covering 5 mistakes that cost between $1,000 and $3,000 annually, some for the rest of your life. I'll explain exactly what triggers these penalties, show you real dollar amounts, and give you the actionable steps to avoid them. By the end, you'll know more than 90% of people approaching Medicare enrollment. Let's dive in. Mistake number 1, missing your initial enrollment period. Here's the first mistake that bites people hard. Missing your initial enrollment period. You get a 7-month window to enroll in Medicare. It starts 3 months before your 65th birthday and ends 3 months after. Miss this window without credible coverage, and you're facing lifetime penalties. Let me hit you with the real numbers. For Part B, you pay an extra 10% of the premium for every full year you delay enrollment. In 2025, the standard Part B premium is $185 per month. If you delay for 2 full years, that's a 20% penalty, an extra $37 per month for the remainder of your life. Wait, it gets worse. For Part D, prescription drug coverage, if you go 63 days or more without credible coverage, you pay 1% of the national base premium, $36.78 in 2025, for each month you delay. That penalty also lasts for life. Let's do the math. Say you wait 2 years to enroll. Your Part B penalty alone is $444 per year. Over 20 years of retirement, that's $8,880. Money you could have spent on actual health care or, literally anything else. Think of it like those Columbia House CD clubs we all signed up for in the 90s, 12 CDs for a penny. It seemed like a great deal until you forgot to send back the monthly selection card. And suddenly you own the entire Yanni discography. Except with Medicare, there's no escape clause. Action step, mark your calendar, 6 months before turning 65. If you're still working with employer coverage through a company with 20 plus employees, you're likely covered, but get it in writing. COBRA and retiree plans usually don't count as creditable coverage. Mistake number 2, not understanding the IRMAA cliff. All right, mistake number 2, the IRMAA surprise, or as I call it, the $1 disaster. IRMAA stands for Income Related Monthly Adjustment Amount. In 2025, if your modified adjusted gross income from 2023 exceeds $106,000 as an individual or $212,000 filing jointly, you pay extra for both Part B and Part D. Here's where it gets brutal. An IRMAA is a cliff surcharge. If your income exceeds the threshold by just $1, literally $1, you immediately pay higher premiums. The numbers? At the first tier, you pay an additional $74 per month for Part B and $13.70 for Part D, totaling $1,052.40 per year. For a couple, double it, $2,104.80 annually. Remember, the price is right? Come on down. But here, instead of winning a new car, you go $1 over and lose $1,000. Bob Barker would disapprove. And get this, IRMAA is based on your tax return from 2 years ago. Your 2023 income determines your 2025 Medicare premiums. That bonus you got, that Roth conversion, that home sale, if it pushed you over the threshold 2 years ago, you're paying now. It's like discovering that episode of Saved by the Bell where Zach Morris has to deal with the consequences of his schemes, except this time, the consequences cost you real money and there's no freeze frame to escape. Action. Pull out your 2023 tax return right now. Add your adjusted gross income plus any tax-exempt interest, like municipal bonds. If you're anywhere near those thresholds, consider consulting a tax advisor about strategies such as qualified charitable distributions or timing large withdrawals. Drop a comment below. Did a Roth conversion or home sale push you over the IRMAA cliff? What happened? Let's help each other learn from these expensive lessons. Mistake number 3, choosing the wrong plan type. Mistake number 3 is the big one. Choosing between Medicare Advantage and Original Medicare without understanding the real cost. Here's what happens. You see a Medicare Advantage ad promising $0 premium plus dental, vision, and hearing coverage. Sounds impressive, right? But many Medicare Advantage plans have a maximum out-of-pocket limit of $9,000 $350 in 2025 for in-network services. Compare that to original Medicare with a Medigap Plan G. You'll pay a Part B premium, $185 per month, plus a Medigap premium, which varies by state, typically $150 to $300 per month. But your out-of-pocket costs are predictable and minimal, no surprise, $5,000 hospital bill. Research shows seniors routinely overspend by an average of $368 per year on Medicare plans, with more than 20% overspending by over $500 annually. For Medicare Advantage specifically, some people were overspending by more than $1,000 per year on average, and over 10% were overspending by more than $2,000 per year. Medicare Advantage is like those K-Tel Records compilation albums from the 70s. But wait, there's more. It sounds impressive until you realize you can't actually listen to your favorite songs without restrictions. You want that specialist? Sorry, not in your network. It's the as seen on TV of healthcare. The other trap? Networks change annually. Your trusted doctor who was in network this year might be out of network next year. And if you try to switch back to original Medicare later, you might face medical underwriting for Medigap, meaning they can deny you or charge more based on your health conditions. It's like New Coke. Seemed like a good idea in 1985, but everybody wanted the original back. Except with Medicare, getting original back isn't always easy. Action step. Before choosing any plan, verify your doctors and hospitals are in network. Call them directly, don't trust the plan's directory. And if you want the flexibility to see any doctor who accepts Medicare anywhere in the country, Original Medicare with Medigap is your Coca-Cola classic. Mistake number 4, misunderstanding employer coverage rules. Mistake number 4 is a sneaky one, assuming that all employer coverage allows you to delay Medicare without penalties. Here's the truth. If your employer has fewer than 20 employees, Medicare is considered your primary insurance, and delaying enrollment will trigger late penalties even if you have employer coverage. And it gets more complicated. If you retire before 65 but your spouse continues working and you remain on their employer's plan, you may not qualify for a special enrollment period later. The coverage must be through active employment. Retiree coverage doesn't count. When you do leave employer coverage, you have an 8-month special enrollment period to sign up for Part B without penalty. Miss that window, and you're stuck waiting for the general enrollment period, January 1 through March 31, and your coverage won't start until July 1. Plus, penalties apply. This is like trying to return a Flowbee haircut system after the 30-day return window closed. You thought you had more time, but you were wrong, and now you're stuck with the consequences. And trust me, Medicare penalties last longer than a bad home haircut. Remember when we thought we'd be driving flying cars by now, like in the Jetsons? Medicare rules are proof we're still living in the Stone Age when it comes to simplicity. Action step. If you're working past 65, contact your HR department and get written confirmation that your coverage qualifies you to delay Medicare without penalties. Ask specifically about the company's size and whether the coverage is considered creditable. Don't trust verbal assurances, get it in writing. Mistake number 5, not reviewing your plan annually. The final mistake is the silent killer, not reviewing your coverage every year during open enrollment. 70% of Medicare beneficiaries don't compare plan options during open enrollment. That's a massive mistake because plans change significantly every year, premiums increase, drug formularies change, provider networks shift, and benefits are reduced. For 2025 and 2026, some Medicare Advantage insurers have been scaling back their plan offerings and coverage areas, resulting in some plans not being available for renewal. Your medication that was covered last year might not be covered this year. Your specialist might no longer be in network. The cost of not reviewing, drug prices can jump hundreds of dollars per year, and switching plans during open enrollment October 15 to December 7 could save you that money. Not reviewing your Medicare plan is like never changing the oil in your '69 Camaro. Sure, it runs fine now, but eventually you're looking at a blown engine and a massive repair bill. Preventive maintenance matters for your car and your health care. Think of open enrollment like recording your favorite shows on a VCR. If you don't program it correctly, you'll miss the episode. Except instead of missing one episode of Cheers, you're missing out on thousands of dollars in savings. And unlike VHS tapes, you can't just buy the season box set later. Create a Medicare.gov account right now. Every October, compare your current plan with alternatives. Check if your medications are still covered. Verify your doctors are in network and compare total costs, not just premiums, but deductibles, co-pays, and out-of-pocket maximums. Let's recap the 5 Medicare mistakes that cost you $1,000 plus. Mistake 1. Missing your initial enrollment period triggers lifetime late penalties, $444 plus per year for Part B alone. Mistake 2. Crossing the IRMAA income threshold by even $1 costs you over $1,000 annually, and it's based on income from 2 years ago. Mistake 3. Choosing Medicare Advantage without understanding network restrictions and out-of-pocket maximums can cost you $2,000 plus more per year than original Medicare with Medigap. Mistake 4. Misunderstanding employer coverage rules, especially with companies under 20 employees, leads to penalties you can't reverse. Mistake 5. Not reviewing your plan during open enrollment means you're probably overpaying by hundreds to thousands of dollars every single year. Know someone approaching 65? Be a friend, share this video. Medicare mistakes are expensive, but they're also completely avoidable with the correct information. Drop a comment and tell me, which mistake surprised you the most? Or if you've already made one of these mistakes, share your story so others can learn. If you found this valuable, hit that like button and subscribe for more no BS financial advice for people who've actually lived a little. I'm Eli Pennywise, and that's your 50 cents of advice. Keep the change.